Hi, it's Dr. Kate, and I wanted to do another episode just on breathing because I haven't done one in a while, and it's one of the things that I do with every single patient, and I do a lot of with people that are stressed, have pelvic floor issues, have any kind of issue. Learning to breathe better is going to help anyone, and I wanted to go over what the 360-degree breathing versus belly breathing that sometimes we get cued through in exercise classes and yoga classes. I love yoga. I've taught yoga for years. And it is much easier to cue belly breathing to help get people out of that anxious, shallow breath pattern. We call it paradoxical breathing. And that is essentially where instead of your diaphragm contracting and flattening down and pushing your organs down, stretching your pelvic floor, getting that cornerstone of your core fired up, we use the little muscles in our neck to pull our rib cage up and take our inhalation that way. So that is not good for a few reasons. That it keeps us in fight or flight mode. It does not engage our diaphragm, so then in turn it doesn't push our organs down and act like that pump. And that decreases circulation, so worse blood flow to our pelvic organs. Now, when you think about the organs in your pelvis, there is a lot going on in your abdomen, not just the pelvis. We've got our liver, our kidneys, our pancreas, our intestines, bladder, uterus, sexual organs for males as well. So to have everything function properly and well, blood flow is a huge, huge thing. And a lot of people, I see a lot of people's health histories every day because as I do new patient intakes, I see what kind of surgeries they've had and what kind of medications they're on and that kind of thing. And a lot of people have had abdominal surgery of some type. And even if it feels very insignificant, like a laparoscopic removal of an appendix or a gallbladder, or just an exploratory procedure. When you have those kind of procedures done, it creates scar tissue within your abdomen. And if you are already a paradoxical, short, shallow breather that is not moving your organs, you have really decreased blood flow. And it is that snowball effect of decreased blood flow, scar tissue in your abdomen, your organ or abdominal organs get so stagnant and they need good blood flow to be healthy. The other main fluid in our body that is super important to decreased inflammation and health is our lymph fluid. And when we don't have that diaphragm properly moving as a pump, it does not pump the lymph fluid around your body easily. And that is your pool filter for your body. So you have disgusting, nasty pool water in your body if your diaphragm is not doing its job and not contracting and relaxing easily. And another, I just listened to a podcast that kind of touched on this. I have a ton of patients that have PCOS and endometriosis, and as they finally learn more about these conditions, they found that people can have endometriosis not just on their uterus, but on their diaphragm. They found endometriosis on patients' bowel and diaphragm and other places. So obviously a hysterectomy is not always going to solve everything for someone. So good blood flow and movement helps with those pelvic organ movement of your lymph and keeping everything vascularized, so good blood flow to the area, which is super important. And it's not just for women, it's for men too. There's lots of men out there with GI issues, erectile dysfunction, those kind of things, and proper blood flow and lymph movement is vital. So trying to get people to switch from the paradoxical short, shallow breath is very important for that movement and that really good abdominal health. And it also, when we switch from the short, shallow, paradoxical breath to 360 breathing, we stimulate our vagus nerves, because those run through the diaphragm. When we're using that diaphragm appropriately, it's going to rub on those nerves and help to physiologically switch us from fight or flight to rest and restore. And we need to be in rest and restore to help with our crazy stress level and all those things. We spend too much time on screens, we spend too much time with blue light, we spend too much time indoors, we spend too much time not physically touching the ground. So all of those things are contributing to a very stressed environment. And as I've realized throughout my many years in practice, is that the toughest part of the job is getting people's nervous system into a safe enough space to actually heal long term. Because just doing the manual physical work is a band-aid, and it will keep reoccurring and coming back if we don't fix that underlying stressors that are contributing to the problem. And that is a very tough, tall order. But trying my hardest to implement new things, and that's why breathing is one of them. So giving people a tangible way to get better vascularization, get better lymph flow, decrease that inflammation, and stimulate your switch from fight or flight to rest and restore. All very important. So now when people tell, cue in a yoga class, for example, breathe into your belly. It's easier and it helps people take it out of their neck, and that's great, but it's not the full package, because especially for my postpartum moms or my men, I have a ton of male patients that have diastasis recti, which is the splitting of the abdomen, where you get that doming effect when you exert pressure. That is going to be bad with belly breathing. It is going to, naturally, your body likes to go to the path of least resistance, and you got a big hole in your abdomen, and then your belly breathing, pushing more pressure out into the hole, you're never going to heal it. And that's just one part. So postpartum, belly breathing, not how I would go about it. Does the pressure eventually get to the belly with 360 breathing? Of course, it definitely does, but that shouldn't be the focus. We want to direct the pressure from your inhalation all the way around so that it equally shares the force, so that the rib cage expands 360 degrees like you're opening an umbrella, nice and even. And depending on where someone is biased towards, so if somebody has a really hard time breathing laterally, they are very self-conscious about their middle, and they have held in their abdomen chronically for years, and they've drawn their belly button in for years, I'm going to cue them and give them certain breathing exercises to open up laterally, get that width expansion on the inhalation, and then allow it to come back together. If somebody has diastasis recti, I might even have them brace the front of their stomach so that they're like plugging that hole up with a pillow or a bolster, or be in child's pose. And then I want them to direct the breath into the back side of the rib cage and really feel if the ribs are close together. On the inhale, we're thinking of expanding each rib far away from itself. So it depends on the person and what their bias is. But we don't want to think straight belly breathing. We want to really hone in on being able to get that equal 360 degree expansion of the rib cage all the way around. And it's very important. It's harder to cue. People haven't breathed like this maybe their whole life, so it's a hard concept to get and very hard to do in one yoga class. It takes my patients weeks and weeks to be like, oh, I felt it. I felt my ribs move out to the sides on my own. It's harder. So I encourage you to not take the path of least resistance and do the easy route, but really focus in and spend a couple weeks doing the 360 breathing religiously, daily. Your brain is a moldable, wonderful organ, and you can make new patterns for your muscles, new brain connection, new memories, and then that will become second nature to you as you breathe throughout the day. And the other thing, like I mentioned with the people that hold in real tight at their belly button, they're trying to keep that flat stomach all the time, or they wear very tight pants, or those, I have patients that wear those, it's like a very tight Spanxy kind of tank top. That is bad for your breathing because it really restricts your ribcage motion. So if you want to wear those kind of garments for like a date night or a wedding or something like that, you know, great, but I would not wear it on a day-to-day basis because it is giving your brain a different pattern that we don't want it to follow. We want that expansion and relaxation of the rib cage. We don't want to train it to be continually constricted. You're going to get stagnant, gross, non-pool filtered lymph, no blood flow. It's just a series of bad things that happen from that. So I definitely recommend not relying on those garments, and kind of think of it as a tube of toothpaste. If your abdomen is a tube of toothpaste and the top is the end of the toothpaste and the bottom is where you squeeze the toothpaste out, if you squeeze in the middle, you're going to get pressure up and down, and it's going to be, you know, forcing up towards the diaphragm but also forcing down towards the pelvic floor. So that X happens on the exhalation. Now, if you have really overactive upper abdomen, when you exhale, if you think of it like that tube of toothpaste, if you're squeezing from the ribs down on the exhale, you're putting all the pressure down onto the pelvic floor. Your pelvic floor is not going to like all that pressure, and that is bad for things like prolapse, which is when either your bladder, vagina, or rectum gets pushed out of your body. Nobody wants that. It's bad for hemorrhoids. It's bad for all of those kind of things that we don't want, that increased pressure on the pelvic floor. So we don't want to exhale and immediately pull the ribs in and then squish all the pressure down towards our pelvic floor. Your breathing, proper breathing pattern should actually happen from the pelvic floor up. So we're squeezing the toothpaste up towards your diaphragm. So the pelvic floor should initiate that contraction, and then we zipper ourselves up and squeeze the toothpaste up on the exhale. So the ribs are the last thing to close. So it's very subtle, and with my patients that have issues with the pelvic floor, prolapse, incontinence, those kind of things, it just takes time. It takes time and repetition and making good habits and good patterns to train yourself to breathe that way. And so try not to take the easy route. If you have a diastasis, do not do your belly breathing. There is a time and place for all different types of breathing. There's lion's breath in yoga, and there's all sorts of different things. But as a general rule, when you're learning how to repattern your breath so that that's what it is for your day-to-day normal baseline breathing, we want that 360-degree breathing, not the paradoxical short shallow breath, and not the belly breathing. So if you have any questions, feel free to ask. I think next week I'm going to talk a little bit of diaphragm vacuum, which is a style of breathing that is a little bit different, but we'll get into that next week. So have a good one.